Now to that GMA parenting alert. Big trending article in the Washington Post that definitely caught our attention. Could teens be snorting chocolate, and what are the health risks? ABC's TJ Holmes looked into all of that. Good morning, TJ.
Yeah, look at your faces here. Yeah. Look at your faces. All right, everybody, let me be clear here. Before you go out and try to grind up your Hershey bar and do lines of it, it's not what we're talking about here. We're talking about a new chocolate-based product that's meant to give you a buzz when you snort it. Yes, there are some health concerns here, of course. Plus, does any parent want to see their child with a rolled-up $100 bill, even if the product is drug-free?
A new way to get a buzz from something that's inexpensive, widely available, perfectly legal, and teens already love it. Chocolate. A new chocolate-based product, Coco Loco, is a powder that users can snort.
It's basically crazy chocolate because it's chocolate mixed with other things that creates a crazy effect.
The product is actually a blend, cacao powder mixed with other ingredients that are often found in energy drinks. The makers claim Coco Loco can produce an elevated mood and a state of euphoria similar to the feeling of ecstasy, and can give you a steady rush of energy and motivation that's great for partygoers to dance the night away without a crash.
Anybody that just wants to party and dance and have a little extra energy, that's mostly our market.
The chocolate snorting craze first showed up in European nightclubs last year, but Nick Anderson, founder of Orlando-based Legal Lean, is now hoping to bring it to the forefront of the U.S. party scene.
I didn't consult with any medical professionals. I basically just saw what Europe was going on with Europe. There was no health issues. It's been out 2-3 years. Everybody seems fine. It's very popular. There's really no negative publicity, so I felt we're good to go.
But many are now wondering, is it safe? Well, nobody really knows. The FDA isn't even sure if it falls under its jurisdiction yet. Telling ABC News, the FDA will need to evaluate the product labeling, marketing information, and/or any other information pertaining to the product's intended use.
And again, they say they are marketing this to people who are over 18 years old. And Robot, get this. In Europe, in some places, it was so popular that some clubs didn't even serve alcohol. They just served this snortable chocolate.
Whoa. All right, TJ, thank you. We've got a lot of questions, and we're joined now by ABC News senior medical contributor Dr. Jen Ashton for some answers. Obviously, the big question is whether or not this is safe. Do we even know?
No, we don't. You know, in medicine and science, we like decades, ideally, or many, many years, tens of thousands of patients. We just don't know. That's the short answer.
Okay.
But to be clear, when there are stimulants involved, we know that there can be physiologic effects on the body. It can increase the heart rate. It can increase blood pressure. Obviously, it can give a jolt of energy. And potentially, if you're talking about high doses, these can be significant.
Yeah, there were some jaw-dropping moments for me in TJ's piece, among them when the CEO said that they did not consult any medical professionals. As a parent, what are your main concerns?
I mean, as a parent of 2 teenagers, I think this is concerning. I think what's also concerning is that teenagers will hear, oh, it's natural, it's chocolate, that means safe. There are a lot of drugs that are natural. You know, cocaine is natural, marijuana is natural. Some medications we use in hospital settings come from plants. That doesn't mean it's safe.
And why it's snorting it? Does that bring it to the bloodstream quicker?
Well, you know, we do give medications through an inhalational route, and there is that blood-oxygen interface, and some medications therapeutically can be safely and effectively administered that way. But when you're inhaling a particulate matter, anything that's solid, there can be risks. It can worsen respiratory conditions, and again, your lungs are meant to take in air.
Okay, I hope everyone heard that. All right. Thank you very much, Dr. Jen. We appreciate it.